Namaskar, I am Dr. Namita Singh, consultant psychologist, Apollo Hospitals. Today, I am going to be talking about a very commonly known and underrated condition known as anxiety disorder. What is anxiety disorder? Anxiety is a common mental disorder in which an individual over speculates, overthinks, and worries excessively about certain impending negative outcome in due course of time. So, for an example, a person may worry about a family member who's gone out for work, that something wrong or something bad may happen to that individual. Somebody may fall sick or who is in a different country or in a different city. A student may anticipate that even before writing the exam that I may fail or I may get less marks. We have so many examples around exam time that some students, because of the pressure or because of the feeling of anxiety, harm themselves even before their exam results come out. That's a hyper state of anxiety behavior and reactivity. So in anxiety, people have an uncanny feeling that something is not right around them or something may go wrong. People, for example, in a social gathering may feel so overwhelmed by other people's behavior that I am being targeted or I am being over focused, that they may stop enjoying the social event or they may stop even attending a social event due to feeling of anxiety. How is it different from normal anxiety? A certain level of anxiety is required by all of us to perform or deliver certain levels of competence or general behavior. For example, suppose I have an exam tomorrow and I am just chilling, not worrying, not thinking, not preparing for it. So it will result into a disaster performance or a bad outcome. Same way, even after millions of years of our changing and adapting to human life, certain anxiety is required for our day-to-day improvement and survival. Suppose I am talking right now and there is a big uncommon third voice around me. It is important for me to look around and try to be anxious to check what the sound is about. If there is a shakiness in the environment, if I see the fan moving, if I see the lights flickering and I am just sitting normally, I may not be ready for the accident which is happening through the short circuit of the electricity wire, which can be disastrous for me. So that level of anxiety is important in our day-to-day living and better improvement. But continuously worrying, overthinking that even in a normal day-to-day scenario, something is going to be wrong and I can't deal with the scenario, or excessively overthinking that all the things around me are negative, will result into compromised life quality. Most of the time in the pathological or clinical anxiety scenario, there is a futuristic outlook towards it. And people are most of the time living in the future, worrying about the future. That is the main difference which results into the anxiety difference when it becomes pathological. Sometimes it even leads to obsessively controlled behavior or compulsions because people are trying to overcome the anxiety by controlling the environment. What we commonly know, obsessive compulsive disorder. In that scenario, lot of people are trying to wash their hands or clean the environment or check and recheck locks and keys and gas knobs because the fear of unknown becomes the most important priority in the life of that given individual. What are the symptoms of anxiety? What are the causes of anxiety? And what can be the treatment plan for anxiety? So, in anxiety, most of the causes or factors are related to basically excessive control. Sometimes there can be again neurochemical changes also in the brain, which leads the person about lot of overthinking, lot of over speculation. Many times in my clinical setup, I have had the scenarios that the children are externally and internally over-regulated by adults or family members. It's a common condition which can happen in students, adults, older people, or people with any kind of successful life system also. For example, lot of celebrities in the cinema world, in theatre, even if they have achieved big success and stardom, they still feel anxious around the release of their new series or movies, because their performance is being watched or rated by a lot of people. Some level of anxiety is important for our betterment and improvement in our life quality and our performance, but over anxiety is mostly debilitating and self-limiting, which makes people incapacitated in a better quality of life. I wish you all well. There is always professional help around. Seek help in time and make your quality of life improved for a better, fruitful and effective life. Thank you and take care. Namaskar.